Welcome everyone to our Nurses Week webinar, the role of cyber clinician in healthcare defense and incident response. I'm your host today, Jessica Davis, the role Director of Marketing and Communication for First Health Advisory. I'm honored today to introduce one of my favorite thought leaders, First Health cyber clinician, Brad Marsh, the EVP of Government Health and Clinical Innovation. Brad is a U.S. Army retiree with more than 20 years of service. He also became a registered nurse in 2011 before he transitioned to the Army Nurse Corps, caring for both DoD and Veterans Affairs patients. He also graduated with a master's degree in cyber leadership in 2015. Brad is not one for accolades, but I say all this to outline where Brad's experience will inform this discussion around the cyber clinician and what that means or could mean when applied within your healthcare organization. We have a short window today, so I'll let Brad do the majority of the talking, but I do want to encourage you all to utilize the chat box for any and all questions. If we don't get to your question, we'll be sure to follow up after the presentation. So thank you so much for joining us. Brad, you are up.
Thank you very much, Jessica. And thank you everybody for coming here. For those nurses on the call, and I saw a few trickle in, happy Nurses Week. You truly are the backbone of the healthcare industry, which is, again, a great time to talk about how cyber clinicians can play a part in this. So at First Health Advisory, like to use the term securing digital health from the boardroom to the operating room. That's that full spectrum operations, looking at delivering the care at the bedside all the way through the data center, HIEs, interoperability, making sure that everything that we put into play is secure overall, and we reduce the overall risk, not only to our organizations, but our patients as well. And again, it's delivering care in the cybersecurity, care of the network, care of the patient. So this is where we vitally like to bring together clinicians, cybersecurity professionals, and have some of those crucial conversations. So you see, we work in a variety of different areas, from life sciences, physician practices, government health, in the virtual health market. And let's move into what we're going to cover today. So what is a cyber clinician? I coined the phrase when I was active duty because somebody asked, what is it you do? And I said, well, I'm a cyber clinician. Well, what is that? Well, you know what? I've answered that so many times now. I want to make sure that I start to inspire others to go become that cyber clinician, to really flesh out how we participate in this organization, at your organization, in the cybersecurity defense of our nation. We're going to cover some of those things with multi-disciplinary rounding. For those who are not familiar with the clinical topic, we'll bring that in. And then we'll also tie in how that applies in the cybersecurity realm. We'll cover some of that cybersecurity hand washing and talk about the complex determinants of overall cyber health. As those clinicians on the call are going to know about the social determinants of health, well, what we're looking at is a complex weaving in the cyber realm. Finally, the cyber incident response, and then open dialogue. We want to make sure that we can answer questions and hear your stories as well. And I'll go ahead and start rolling through what we've got. What is a cyber clinician? Again, this is something I have been asked time and time again. As David Finn and I, along with Teresa Meadows and a variety of others, sat with the Healthcare Industry Cybersecurity Task Force report to Congress, we had to talk about cybersecurity, but we had to do so in such a way that we are able to deliver care to patients still. And so what I was doing is relating how I, as a clinician, utilize the computer, the digitized IV pumps, all of the connected assets, IoMT, IoT, just like I do my stethoscope, like I do my forceps and mirrors, and all the other tools that I bring to bear to deliver care. It's utilizing a vernacular of clinical care delivery in the cyberspace, being able to bridge that gap between a cybersecurity professional and that of a clinician. We've seen it before, and we'll talk more about it as we move forward, but there's very much a dichotomy. You've got your clinicians, and you've heard the phrase, I just want to take care of my patients. You talk to the cybersecurity personnel, that people are our biggest vulnerability. What we as cyber clinicians look to do is bring those two together. You can turn your greatest vulnerability, your clinicians, into your greatest assets, because it is those people that are delivering the care that know when a medical device doesn't look quite right. They know when something isn't working. They know when a system operates outside of its normal parameters. They may not be able to pinpoint exactly that it's an SMB attack, but they know something isn't right. It's called gestalt. And that's what clinicians really rely on. With all of the knowledge they've got, it all boils down to something isn't right and digging in. Leverage that as a tool. Conversely, the cybersecurity personnel are trying their best. They are fighting hard to make sure we are protecting our networks. Our confidentiality and integrity of the data is there. Lock it down. You know, I once heard somebody say, the only server I trust is one that is powered down, wrapped in lead, buried in concrete, and thrown in the middle of Potomac. And even then, I don't trust it because I can't run audits. That is the perception of what cybersecurity is to those at the clinical bedside. What we seek to do is really balance that confidentiality, integrity, and availability. We can talk Parkarian, Hexad, we could talk all of that. But the bottom line is the CIA triad gives us those basic building blocks that we need to really get a shared understanding across all of our personnel. Cybersecurity clinicians, we are the ones that say, hey, look, let's work together on this. Let's balance out the availability. I need to be able to take care of my patients, so I need the data present at my fingertips. I need to be able to deliver care with the right information at the right time about the right patient for the right reason. By doing that, that requires me to have full access to a lot of pertinent data. The cybersecurity team is meanwhile trying to defend this data and lock it down. What we need to do is start looking at how can we work as a team to establish the foundational guidelines. When you look at shutting down certain ports and protocols, or tri or quad factor identification, other things that we are doing that are trying to protect the confidentiality and integrity, what is it doing to the clinical care? What is the clinical impact? Those are the questions that we ask, not to thwart the cybersecurity, but rather to seek further understanding, to then be able to say, hey, this is a med room. Inside this med room, to get into it, I have to know a cipher lock. Then I have to use my thumbprint. So already I've got multi-factor, but the thumbprint is the only thing that's on a technical system. The cipher lock could be a mechanical cipher lock. That's where, by sharing what the actual workflow is and how they are doing the care, that's where we can start to find ways to work together. Are there other mitigations that would have less of an impact to care delivery? At the same time, if there's not, we are able to help parlay some of that conversation from the cybersecurity team to the clinicians to really understand why. When I was active duty, you know, I heard people complain about having to use a card and PIN to access the electronic health record. And I heard somebody say, what are these, national secrets? And it's, yes, it's aggregate data. These are very important, and we'll talk about it further on down the line. But we are the healthcare infrastructure sector. Our sector delivers the care to the American people. For my international friends, that may not be the same in your area, but for us, we are commercial, public, private entities, all delivering care within a broader infrastructure sector. If we do not protect the infrastructure sector, it jeopardizes our security strategy overall. So this is something that we need to be aware of as we move through how to best secure our industry. How do we do this? Talked about bringing in clinicians and bringing cybersecurity people together. We had the same problem in healthcare years ago, in that the cardiologist would walk in and prescribe drug X. The pulmonologist would come in an hour later and they'd recommend drug Y. They wouldn't communicate. They wouldn't talk. The nurse, if they were lucky, was at the bedside when both of them were there. Chances are that nurse was more than likely pulled to another patient because they had things they had to do and weren't able to time it exactly at the same time those specialists were in the room. This caused many drug-drug errors. This caused competing therapies and really put patients in jeopardy. So together, the clinical teams came together and said, we need to do multidisciplinary rounding. That's where you bring in your nurse, your physical therapy, your pharmacist. Everybody takes a holistic view of the patient and they openly communicate, because there are drugs that can treat both a cardiology and pulmonology situation. There are some drugs that have to be done in isolation because otherwise they will cause untoward effects. By pulling those together, we started to realize a reduction in patient safety issues. This is time, our time now, to pull together our multidisciplinary cyber rounding. This is where we, as geek clinicians that started out in our early days by being shadow IT, there's a few people on this call that have just shuddered because shadow IT is a risk to everybody. But by pulling in those that have a penchant for the technology, who understand the clinical, by bringing them into the fold and working hand in hand with them, you talk about, hey, we've got this connectivity engine behind the bed. It has 4 open USB ports. We need to shut those down because of X, Y, and Z cybersecurity. What is that going to do to you, the nurse? Oh, well, if you shut those down, when I bring in this pump, or I bring in that ventilator, or I bring in this, now they won't work, and I've got to go get a ticket to unlock said port. Ah, that's a problem. Now we can look at the patient, which is our network, which is our hospital system, and we start to look at how can we mitigate that risk with activities or other capabilities that allow the clinician to still deliver care as optimally as possible while at the same time being cyber secure. This is at all levels. You know, we talked about the interdisciplinary rounding. We had the hand washing push about 10 years ago, where we started adding on saying, hey, scrub in and scrub out of every room. This tried to make sure that everybody was keeping nosocomial infections isolated. We were not causing hospital-acquired infections by our interactions with our patients. This added a level of hygiene on top of a base understanding of hygiene. Switching into the cybersecurity realm, we never had that base level of hygiene established for cybersecurity. We had computers deployed into hospitals. Here, chart on your patient and just get it done. Oh, by the way, now we're going to multi-factor authentication. We're going to lock this down. We're going to lock that down. And it's one on top of another. But were they already maintaining a level of cyber hygiene that we could add to? The answer is likely no. So this is where, by working with your clinicians and bringing them under your wing of cybersecurity, talk about what is relevant to them. Meet them where they are at. Every time we go to an organization, this is one of the things we always talk about. What is your guidance to your people on taking care of their personal devices? I've done numerous talks with multiple professional organizations where I point out, how many of you connect to open Wi-Fi with your personal phone? I'm not talking your professional, I'm talking your personal. How many of you have posted pictures of your kids? How many of you have an open file share and not really tracking who's got access to it? Those are the things that are going to matter to people the most. When they start to understand that their cyber hygiene practices in their own personal world are important, you help them become more cyber secure. They then have a base level of hygiene that now those things that we add at home or at the office are just one more, something a little bit more to strive to greater cybersecurity resilience. A great way to look at this, how many of you could go to those CPGs that were just released, the cybersecurity practice guidelines? Those can be applied at home. Teach them how to use the CPGs. One, it'll help you really relate to them. Why is it important? But then when you talk about it at work, it really makes the dots connect so that everybody becomes an active participant in the care of the network. When we can take care of the network at that lowest level, we start to really address the complex determinants of cyber health. Right now, there are organizations out there that they are not operating in the black. They are solidly in the red. After the CHC breach, everybody is still licking their wounds. This is so vitally important because underserved populations that already are operating very solidly in the red, they may not have the budget, the funds to go forth and do more security efforts. That causes a problem because now that critical access hospital, that underserved population, may not have the same level of cybersecurity as one that operates with a moderate profit margin. Then that creates a disparity, and that further jeopardizes our security of that greater infrastructure. When the smallest fall, that's the first domino in the chain. We saw that with CHC. We saw it was 3+ party risk. Some of these organizations aren't even able to address the third party risk, let alone the 3+. That's where it is so vitally important that we engage everybody. We have to empower everybody to become an active participant in our cybersecurity structure. This then protects us overall as a nation. Being active in the active defense also is the proactive approach. But then we have to be prepared for the reactive. It is a reality that we are under attack every day. The healthcare industry writ large is seeing an increase in attacks. We saw a nationwide impact of one that lasted well over a month. We continually see these increases over time. So we need to determine how we are going to fail. Do you fail like the Miracle on the Hudson, or do you fail like the Hindenburg? These are two images that I want you to have in your mind. We should always be proactive, but we should always plan for the worst case scenario. By having your clinicians involved in your incident response, you begin to really make sure that, one, you control that narrative. You work with your clinicians to ensure that we can still provide the highest quality patient care that we can, even in these degraded states. How do you practice this? I'm glad you asked. That is the playbooks. You have to exercise your playbooks. There are many out there that actively have these playbooks sitting on that wonderful desk over maybe in the basement, usually with 1 or 2 TVs around it, and there's a lot of dust on it. You have to go in, you have to shake those off, review them, interact with them, get the clinician at the door. You've got to be able to make sure everybody understands what's happening. Carter Groom, our CEO, and I attended multiple events here in the DC area where we saw simulations where they didn't tell the doctor what was going to go on, and they simulated a cyber attack. The screen behind the provider goes with a red skull and crossbones as ransomware. The provider still turned and looked at the monitor and depended on the monitor. These are things that we need to make sure that is well understood. In the event of a cyber incident, do we still rely on that? Do you still have active drip sets that you can go and count drips for an IV drip? When was the last time that your nurses looked and made sure that the sphygmomanometers or blood pressure cuffs were available, were calibrated? They have rubber tubing. The rubber tubing dries out over time. That changes the resiliency of it. That then changes the blood pressure reading and leads you down an inaccurate pathway and patient care. That's why making sure that we can fully execute our downtime missions while delivering care is involved. This then helps the cyber team understand what is happening while they are in the trenches fighting the battle. It gives a why to why do we have to move faster on lab, rad, and farm? Well, lab, rad, and farm, when it's back online, those have to be in for me to continue to use the electronic health record accurately to make sure the drug-drug interactions are checked. So those have to be loaded even before I, as a clinician, get to turn my EHR back on. These are the kinds of things that having a clinician in the room, working through the playbook, touching, feeling, and interacting with the teams, you now can really appreciate both sides of the equation. One is not better than the other. We are a truly interdisciplinary team. So we had 30 minutes. I've got 7 remaining, and I am more than welcome all of your comments and questions. I really want to engage with you because including those cyber clinicians into your workflow, into your teams is so vitally important. So I'll pause and wait for comments.
Yes, so please pop it, your questions into the chat box, but we can get everyone started. I think that we've often pondered this question where it's like clinicians may not want to go through another training, or just sort of how do you inspire that passion or incentivize it? How do you see this sort of playing out in action?
That's a great question. I think really it comes back to you meet them where they're at. Make it important about them. Make this about their family. How are they securing their home network? When you have that base level of cyber hygiene, my daughters are both well versed in this, to the point where somebody said, "Oh, just connect to this hotspot. I'll give you access." My 13-year-old is able to say, "No, because my dad does not want me to connect because there could be a man in the middle attack." 13, understanding man in the middle. Now, yes, I am a cyber clinician and we work hard on this, but it's really engaging people where they're at. We need to be able to answer their questions, make it important for them so that when we ask them to help carry some of that cyber load at the hospitals, it's not that much more of a lift.
Hey, Fred. Very good, very good. But I would say that it's helpful, the examples you used of the tools, for example, the blood pressure cuff, operating tool, etc., and how that works with the cyber. I always saw cyber as like out there in the clouds somewhere. So that really was helpful to me as a former bedside nurse, how the tools of my trade are impacted on patient care by the cyber part.
Absolutely, Chris. And it's that we try and make sure that as we go through and do tabletop exercises, we've done a few of them. A lot of people do that. They think, "Oh, cyber, we can't do anything," and they start to lock up. And it's like, wait a minute, we can go back and we can continue to deliver the patient care because there are other tools we have available to us. And as David says, by pulling that IT and clinical together, we really start to solve the bigger problem. We must still deliver care. We have to take care of our patients. We cannot do it in isolation. I, as a clinician, can't do it without my IT and cybersecurity counterparts. My IT and cybersecurity counterparts need the clinicians to be able to deliver care. We are a team, and that's what we need to carry forward as cyber clinicians.
David sort of added on to that, which is sort of understanding that a lot of IT people may resist sort of that caregiver participation. So maybe you can get the clinicians on board from one angle, but how do you get the IT to sort of accept that sort of influence of the clinician into the design, the process, the governance, and things like that?
And that's going to depend on leadership. We need leadership. We need those nursing leaders who may be themselves insecure with the cybersecurity intersection. You find your geek nurse, and I say that as a geek nurse. Early on in my nursing career, as when I transitioned from air and missile defense into nursing, my chief nurse looked and said, "You have a penchant for technology. You need to pursue this more. Here, go down and go talk to IT about this problem." You find your geek nurses, empower them. Also, engage with your peer at that leadership level in the IT department. We can no longer be afraid to walk into each other's hallways. Let's talk. Let's take care of it. We deliver care to take care of patients. We need the tools and technology that supports us. This includes, and my biomed team would be so mad at me if I didn't include them in my last closing remarks, and that is, you should not avoid your biomed team, who are likely in the basement right beside the security people, but they're not talking either. You need to break through those walls. You need to be talking to biomed, you need to be talking to information security, and they need to be talking to you. That triad is such a powerful triad. Those most successful hospitals we have seen are those in which there is regular interaction, that the biomed team knows they've got to take something offline. They know which nurses to go talk to be able to hot swap on a live patient, monitor A for monitor B. That is one of the most important parts that we need to be able to do, is bring everybody together. We cannot do this in isolation anymore. Interdisciplinary rounding in the cyber realm is upon us.
It's a pleasure. I think that we are out of questions and out of time. I want to remind everyone that on Thursday, we'll be diving into more of safe and secure implementation of digital health technologies, how that looks. I've popped the link into Thursday's presentation in the chat. Yeah, thank you all for joining us. We're really excited. Make sure to follow us on LinkedIn if you aren't, and connect with Brad after. He'd love to answer some more questions. All right. Thank you all for joining us.
Thank you, everybody.